Hello student, in the last lecture on skin we learn about the structure of the skin, then we learn on the type of the skin, if the thick skin or thin skin, and then we also learn about the functions of the skin in details. Now in this lecture we are going to cover the clinical importance of the skin in the form of the Langer's line or the line of cleavage, and then we will also learn about how to calculate the surface area for the purpose of the burn. Okay, so we go to the next slide for the uh, structure of the dermis of skin. Here just I have put this slide, hand drawn slide, just to revise the dermal part of the skin. Here in this you can see that the skin consists of the epidermis. This is stratified squamous epithelium, and beneath this stratified squamous epithelium, this area is the dermis, okay, which is made up of the dense connective tissue, mostly the collagen fiber, but then there are the presence of elastic and reticular fibers too, okay, but predominantly it is collagen bundles which are running in the dermis. Now in this dermis you can see the presence of hair follicle attached to which is the sebaceous gland. This is the sweat duct, gland duct, and this is the sweat gland, okay, and beneath this dermis this is the hypodermis or the superficial fascia. Now, this is the structure of the skin, and our main concentration for the line of cleavage or this Langer's line will be the arrangement of the fibers, collagen bundles in the dermis. Let us see what are these Langer's line. Now, this line of cleavage or Langer's line, as I said you, these are the imaginary line. Imaginary in the sense that you don't see any line on the surface of the skin of your patient or on your own body, but these are the lines which are drawn by the scientists by doing the experiment, just by finding how this bundle of collagen fibers are arranged on in our dermis. Okay, now this bundle of collagen fibers in our dermis are arranged parallel to each other. See here, these lines in the are indicating here that these fibers they mostly run parallel to each other, though there are some haphazard fibers of collagen bundle which are also running in the dermis, but most of the fibers within the dermis they are considered to run parallel to each other. And why they are running parallel to each other? Because they indicate the I mean to say the stress to which the skin is subjected. That means if a skin is just under tension or stretch, then the collagen bundle will be just will form. Okay, then they will arrange themselves in the line or parallel to that of the a stress line, okay, parallel. So what these collagen bundles are, this Langer's line, okay, which are in dermis, they indicate that the skin is subjected to the stress in different directions, okay, in different direction, and on the basis of those uh, direction this line are arranged into the, I mean say this bundle of collagen fibers they are arranged into the dermis, okay. If you will see this, you will see that these lines of I mean say cleavage, they are not same everywhere in the body, okay, everywhere they are parallel, okay, at though they are parallel, but this running of this collagen bundle is different in the trunk and in the limbs. In the limbs you will say that most of this collagen bundle which are running parallel, they are mostly vertical, some may be oblique, but more towards the vertical direction in upper limb, as well as you can see here into the lower limb they are mostly vertically arranged. But when you will see this line of cleavage or Langer's line, then these lines are circumferentially arranged in the trunk. Okay, I'm sorry. In the trunk, these lines are arranged circumferentially. That means they are running transversely, okay, in the front of the uh, trunk and in the beak of the trunk, okay. So these Langer's lines were determined when I say in the summary, this was determined on the basis of the direction of the collagen bundle, uh, uh, which were arranged into the dermis, okay, in the dermis. Now these lines are drawn by, I mean, so they are already prepared maps of these lines, okay, and surgeons, they refer to these lines or the direction in the area of their interest. Suppose if they are, I mean to say, giving incision into the back of the forearm or the front of the forearm, they first decide the direction of the collagen bundle seen to that map, okay. Let's come further to this arrangement of the Langer's line. Now surgeons give incision always parallel to the Langer's line, okay. After studying the Langer's line directions in the skin, they will give the incision which is parallel. Say for example, if a surgeon want to give an incision in the front of the leg, ventral aspect of the leg here, anterior aspect, he will give the parallel to the direction of these Langer's line. Now if he gives parallel to the direction of the Langer line, and if he wants to give incision in the beak or the front of the trunk, he will give the incision again parallel to the lines where these lines are arranged transversely, okay. If he is giving the incision which is in the dermis parallel to the Langer's line, then there will be the gap of the incision will be less, okay. That means it will not have a wide gap, the incision, okay. And this I mean to say gap will heal very quickly and with the minimal scar. What do you mean by scar tissue? Scar tissue means when a wound heals, there is the formation of the bundles of collagen, and that fills the gap of the that is wound, and thus the wound heals completely, okay. So this scar tissue formation will be less because there is a minimal gap, okay, in the incision, okay, two sides of the incision. However, if suppose a surgeon will give the incision which is at right angle to the parallelly running these lines, then what will happen? Then the gap will be there in the wound, okay. The wound will have uh, a big gap, and then the healing will be difficult, and there will be healing will takes place by formation of the lot of the collagen fibers, okay. And thus what is said that an ugly scar will form, okay. So this is the importance of the Langer's lines or the line of cleavage, okay. Now, coming to the second aspect of the skin, which is important, and mostly the short notes on the exams are asked on these two aspects: the surface area of the skin and the skin burn, okay. This is the topic, I mean say we will deal with this. First I will tell you how to calculate the surface area, and then what is the skin burn and how this surface area and severity of the burn is calculated, okay. In case of the skin burn, a clinician calculate the area, a rough area calculation in terms of percentage. That means whole body, if you can consider the skin of the whole body, right, 100%, when if you actually measure the surface area of the skin, that is around 1.5 to 2 square meters, 1.5 to 2 square meters, okay, depending on the size of a person. This area is, the calculation is done always in terms of percentage, okay, not in exactly the surface area in square centimeter or square meter, like that, okay. Now they follow a rule of 9 for quick calculation, okay, an approximate, not very, I mean to say accurate calculation. This is an approximate calculation is done with the basis of this rule of 9, okay. And in infants and children, this rule of 9 will not apply, because I'm talking about the rule of 9 is will applicable only in the adults, okay, right, not. But if you are calculating for infants and children, then the surface area of the skin, then you have to make some adjustment. Okay. So this formula for rule of 9 for calculation of the surface area of the skin, especially for burn, is not applicable for infants and children. That you should know. Now let us see what is that rule of 9. Rule of 9 is that various parts of the body, the limbs, the trunk, its ventral and dorsal surface, they are divided and they are given a rough area in terms of percentage. For example, head and neck is the 9%. Okay, the surface area of the skin in head and neck region is 9%. Similarly, the upper limb is 9%, including both the ventral and dorsal, that is flexor and extensor surface of the upper limb. Then the other upper limb here is again 9%. Okay, back and uh, and if you calculate the trunk, okay, the trunk area is 18%. That is the anterior aspect or the ventral aspect of the trunk, which includes the thorax and abdomen. That is 18%. And similarly, the 18% is for the back. Okay, so and there is only 1% is given for the perineal region, what is where your genitalia are located. That is only 1% of the surface area covering. Now for the leg, there is again each leg is 18%. Okay, has surface area 18% on the ventral aspect as well as on the dorsal aspect. Okay, so anterior and posterior surface of both the lower limb, okay, not the leg, sorry, both the lower limb, they will be having the 19% means 18% each. So in this way, if you calculate on the basis of this rule of 9, where it is multiple of 9, okay, then you will say that this completes the 100% of surface area of the skin. Okay, so the lower limb 18 percentage, upper limb 9 percentage, the front of the trunk 18%, okay, which is a multiple of 9, 9 twos are 18, and the back side of the trunk again 18%, head and neck it is the 9%. Okay, so this is just a very simple, I mean to say, a formula to calculate the surface area. Then the surface area is also calculated very quickly by another method, what is called as the hand area rule. That means the surface area of the hand of the patient who has suffered from burn is equal to 1% of the skin. Okay, that means the whole palmar surface of the hand, if you see this surface, palmar surface of the hand, and if you take it as a rough guide, this will indicate 1% of the skin of the body, out of 100, 1%. So this is a very quick and rough area for measurement of the surface area of the body. Now we come to another aspect again, okay, after just learning these two methods of calculation of the surface area of the skin. Now the severity of the burn not only depends on the surface area of the skin, so uh, but it also depends on the depth or the thickness of the skin which is burned. That means it is not only if epidermis is burned, but if it is the dermis is also burned, it will be naturally more severe burn will be. So there are two factors in calculation of the severity of the burn. One is that you just find out what is the surface area of the skin which has was burnt, and then second is whether it was a superficial burn or it was a deep burn or whole thickness of the skin was burned. Okay, the both the factors are needed for calculation. Okay, and why a person has to, I mean say why a doctor calculates. Thus, just to assess the severity of the burn, there are 3 degrees. Okay, the first degree burn, second degree burn, and the third degree burn, depending on how much thickness of the skin is burned, irrespective of the percentage of the surface area. Okay, it is just the thickness of the skin burn. Now the first degree burn, here there is only destruction of the epidermis, that is the epithelial layer of the epidermis is only destroyed. Okay. Now this epidermis, if it is destroyed, okay, this is the, as in case of the sunburn. Okay, we person or you, if you are playing cricket outside, okay, in summer days, and then your skin become blacks, and that is the sunburn. Okay, that is sunburn. Now this sunburns heal very quickly within 3 to 6 days. And why this sunburn heals very quickly within 3 to 6 days? The reason is that here your epidermis is only destroyed, and epidermal cells, they grow very fast from the stratum vessel. The stratum vessel cells will destroy, I mean say will divide very fast and will push the surface cells. Okay, so new cells are formed very quickly. So it just take only 3 to 6 days to become to heal. Okay, heal will, that means your color will once again improve. Second degree burn. Okay, coming to the second degree burn, epidermis and part of the dermis. Okay, here second degree burns means the whole of the epidermis is destroyed and a part of the dermis is destroyed. Okay, not the total dermis, but a part of the dermis is destroyed. This is called as the second degree burn, and this kind of the second degree burn, it heals within few weeks. Why it heals within few weeks? The reason is that here, because the dermis is destroyed, and dermis heals by formation of the bundles of collagen fibers, which is a slow process. It is not as fast as it was in case of the epidermis, where it was an epithelium and cells were dividing very fast. Now coming to the third degree burn. Okay, and in this third degree burn, the I mean to say, this is decided on the basis of the thickness of the dermis, where the whole thickness of the dermis is destroyed. That is the third degree burn. That means not only epidermis but also the dermis is destroyed. Okay, so here the whole dermis is destroyed. That means the wound is going deep right up to the superficial fascia or the hypodermis. Okay, now this kind of the third degree burn is very difficult to heal. Okay, of its own it never heals, probably, if it is a considerable surface area is burnt here in third degree. Now this only can heal with the help of the skin grafting. What is skin grafting? Here the healthy skin tissue, including epidermis and part of the dermis, is taken from the body, and it is grafted onto the site where the skin is totally burned. Okay, now, or where there is the third degree burn is there. Now if this graft is taken from the patient himself, say for example, if there is burn is somewhere on the face or on the upper limb, okay, the skin can be taken from the thigh region and just planted or grafted on the wound site. Okay, but and then there will be no rejection, immune rejection, because tissue is of the same person. But if you have to do the skin grafting for a large area, naturally you cannot take out all the skin from the body of the same patient. You have to go to the skin from the other source, that means from other person. Right, this skin which is obtained from the other person has the chance of the immune rejection, and this immune, to avoid this immune rejection, lot of the laboratory tests are done, and the tissue typing and tissue matching between donor and recipients is done, and if matching is perfect, then only the skin has to be I mean to say grafted. Okay, and so it will not be rejected. Now, the this last sentence here, which is underlined, is important. Okay, and this will tell you how the skin, not only the surface area, but the depth of the skin burn is taken into consideration for the calculation of a major burn. So what is the definition of the major burn? Is that it includes the third degree of the burn. So what it includes? it includes the third degree burn, that means where whole of the thickness of dermis is destroyed, okay, over the 10% body surface area. Over, so this 10% body surface area is very small area, okay, compared to the 100% of the body surface area. But here the thickness of the skin burnt is total thickness, so it is considered as the major burn. On other hand, if the burn is of second degree, where only the dermis is destroyed partially, not fully, okay, and if this I mean to say burn surface area is extending up to 25% of the total body surface area, then this is also considered as the major. So just compare 10%, okay, with the third degree burn, and 25% surface area with the second degree burn are considered as the major burn. Now this calculation of the surface area of the skin as well as the degree of the burn, first, second or third degree, are important to assess, as I said, to the line of the treatment, okay, as well as for prognosis, where just to assess whether the person will survive after the burn or he will not survive after. I hope that you have understood the two important aspect of the skin. Thank you very much.